Hi, welcome to today's Leaders in Mental Wellness and Diabetes, where you will hear insights from the top minds in the world of diabetes care. Hosted by Dr. Char.
Riva Greenberg. She's an author of 3 books. She's a diabetes advisor, inspirational speaker, a global expert of flourishing with diabetes. She's a treatment approach about flourishing. She is a wellness coach. I could just go on and on. Riva just received an award for flourishing 50 years with diabetes from the Joslin Diabetes Center. Riva, welcome to this podcast.
Thank you. It's a pleasure.
We're so honored already. I know everybody that's going to hear it is honored to meet you. How in the world are you, and where in the world are you?
How I am is really well, feel fine, happy to be here. Where I am specifically is my living room office in Brooklyn, New York.
Awesome. Awesome. And it's pretty. I love that brick background.
Thank you. I was just going to say, this is our pretty traditional brownstone brick look.
It's so good. I fake a bookshelf behind me trying to replicate an office. And
you did a good job.
I'm learning this new world of online. I've been doing what I do for 100 years, but this online stuff is all new to me. But diabetes type 1 is not new to me, and I understand it's not new to you. Could you tell us about that 50-year journey? And let me just say before you start, I just think it's so important that we have casual conversations. My goal, my dream, and my daddy said it doesn't cost a bit more to dream big than little. And my dream is that after somebody has gone to a doctor and rushed through this appointment and that appointment, gotten all the information they could, maybe feel a little overwhelmed, they could just sit down with a cup of coffee and listen to the pros, listen to other patients, just listen to how it all happened in somebody else's life and how they're flourishing, all the good and sometimes the not so good, but that we can just, as a community, build trust, encourage, just help somebody. So would you start today by sharing with us that journey of 50 years?
Yeah. Well, I just put a post on my blog, Diabetes Stories, about this. And as I said in my post, if I were to write about my 50-year journey, it would be a book. So I will tell you what I can, and of course, want our listeners to enjoy and get some encouragement and inspiration.
Sure.
But we all have our own journey. We all know that. But it's amazing how much community can help bring us along. So I was diagnosed in 1972 when I was 18 years old. And I had all the classic symptoms, but had no idea. I didn't know anybody with diabetes. And oddly enough, I was going to college away from home and staying at the dormitories when they closed the dorms for 2 weeks and sent us all home because they were going to use them for athletes who were headed to the Olympics to practice. So I got home and I had one of the symptoms I'd been having for 3 months, which is I would wake up in the middle of the night with these horrendous Charlie horses and, this knot cramp in your calf. And I woke up in my parents' house with that, screaming because it was so painful. And my mother said, we're going to the doctor. So I'm sure I told him my symptoms and he took a simple blood test and diabetes, off to the hospital. So I spent four days, I was about to say 4 years, maybe it felt like 4 years. I spent 4 days in the hospital and I had a really cold doctor. I would love to look him up today because he told me about all the complications I was going to get. And he gave me 2 books to read about them. And one day he was sort of telling me all this and how my lifespan was going to be 15 years shorter, right? Here I am, 18 years old. You can relate.
Hi.
And my parents happened to be there. And my father, who was typically soft-spoken, got so angry at him for scaring me that he yelled at him, "Don't you realize there's a person in that bed?" And the doctor really backed off. And I find it kind of funny that the work I do today is in diabetes, and I encourage people to flourish. And I share with health professionals an approach to working with people with diabetes that helps them flourish rather than just cope. So, yeah, so that was the beginning. And then I didn't know anybody who had diabetes for another 22 years, not until I was 40.
Wow.
And it wasn't until I was 48, it was the year I was getting married, that I decided to go to a diabetes educator for the first time because I wanted to be healthy for both of us.
Mhm.
I joke, is that a little bit like when a woman says, "We're pregnant"?
That's right. It's so right.
and I had just, so that year was kind of a milestone. I had just lost a job because the company I was working for went bankrupt. I was having frozen shoulder surgery, and I was seeing a diabetes educator, and I was getting married. And all of that stimulated me to think, I'd always wanted to help people. I had no idea it would be about diabetes. I just always wanted to help people basically believe in themselves. And this door opened up, and I thought, well, why not with diabetes? And so that started me on this road. I started writing because that had been my profession as an advertising copywriter. I started getting published in online magazines and then the HuffPost for 7 years. I wrote 3 books, as you mentioned. I started going to conferences to learn from others. And then I started getting invited to conferences to speak about flourishing with diabetes. And I used to joke every year that I was in my 5th year of my 20-year overnight success. And this is my 20th year.
Wow.
So the fact that it's my 20th year and also my 50th year living with diabetes, well, yeah, I guess that's historic for me.
Oh, it is historic. It is an amazing story, what I have followed and what I have read. Every little girl who's been diagnosed needs to read your story. I was 16. I was married, going to high
Wow.
school, and living in Germany. First time I'd been
Whoa.
out of the country, first time I'd been away from my parents. Who in the world? That's all a book all in its own. But anyway, when I was diagnosed, I had no time for the story, but there were female problems from the time I was 12, 13 years old, and nobody knew then what they know now. And doctors have said there was a connection, a correlation. They're sure of it. But I was 16 before I was diagnosed. And again, married, I thought, will he stay? Will he want this burden? Because the way the doctor described it, it was almost like a death sentence without saying that. And so I didn't know if he would stay. Well, 48 years later, he's just across town counseling people in another country right now. So he hung around, and I finally graduated high school. But I dreamed of, as a teenager before I was diagnosed, of being a doctor. I neither knew that I would be helping patients with diabetes, but I knew I wanted to help people. And my life had already led me. I thought I was grown up, and I was already helping people just by my spot in life. And so I went to school for counseling psychology. And consequently, I find myself today, you're too late to tell me you have to die early. You have to, because I've kind of made it. And I'm behind just a couple years with the disease, but isn't it something how the technology, my phone today tells me every 5 minutes what my blood sugar is. I didn't have a monitor. I'm sure you didn't. I read pen on a stick. Oh my goodness. We were the ones, weren't we? And it
Well,
would,
actually, I will ask you, when you got it, I assume we were using plastic syringes at that point. You didn't have to boil and sharpen
no,
steel needles.
no.
So we were lucky already compared to what came before us.
Right. And it wasn't that long before us.
No, it wasn't.
It really wasn't that long before us. And yeah, it's, I don't think it's just me. I wanted you here so badly. I don't think it's just me. I know you've reached lots of people in your life with this, but maybe the ones I could influence. I work in mental health, so there's a whole side of life that was overlooked in the diabetes world for so long. First of all, I've had doctors say to me, I would love to refer patients to you, but I don't want them to feel like I think they're crazy. I don't say that's poor on the doctor's part. I say that's where we were, because mental health was considered mental illness and nobody wanted to, it was not in vogue like it is today. It's in vogue today. Everybody wants one. You know, I have kids come to me, I have teenagers, they just want a counselor. They really don't know what problem they have. They just want to count. It's the funniest thing. And it's not funny, but it is. And so my world has taken me down a path that makes me today, as a patient, want to know you. It's a knowing, it's a casual knowing that lets me have trust, that can help me grow as a patient. But as another professional, it helps me as a patient to know you in that arena of where you have flourished and you've taught others to flourish, but you know exactly where I've been. I know we don't have to have a disease to help others with that disease, but boy, isn't it enhancing when I can know that you say you flourish with your spirituality, you flourish with your words, you flourish. And it's not everybody that can articulate it in a book. So we need you.
Well, that's very kind. But, you know, I think, of course, we all have different talents and gifts. And it was Ken Robinson, an educator, who said, really, the most joyous thing is when you're using your talent. And I think that's really true, right? It incorporates that sense of purpose and mission and authenticity, and you're connected to what you're good at and what you love to do. So I feel very blessed. You know, I guess this is the cliche, making lemonade out of lemons, but you know, I used to say you can have a great life, not despite, but because of diabetes. Because for me, it's opened up so many doors. And as you said, it is the work I do, and I love it, and I'm good at it, and I have reached a lot of people, and it just fills my heart to think that a lot of people somehow have a better day because of something I do or say or write. So, and at the same time, I'm very humble about that. And I just wish for everyone they should find their gift and find a way to use it.
Of course, we want to reach as many as we can, but just the one, I think of the one individual that might see this and go buy a book and might be encouraged. And
My book.
Yes. And might be encouraged and might be able to better understand themselves and better trust themselves because you trusted you, and the way you articulate is so healthy, and then to be awarded. I mean, come on now. It's one thing to make it 50 years. It's another thing for a community as large as Joslin Diabetes Center that we all admire, especially we patients, you know, that never maybe you'll ever be there to receive the help from them, to know that they've honored you and respected you in that way. It's, you know, it's hopeful. It's not about the award. It's not about grandiose. It's hopeful. It's all those things that before maybe before COVID, but before this technology was so readily easy to all of us. You think about that. We maybe would have never known, and you would have enjoyed it around the world where you are. But in this way, that one individual that needs encouraged today can receive of it. I think that is amazing. Maybe I'm Pollyanna, but I think that's amazing.
Well, I will say about Jocelyn, and a lot of people don't really even know, but Jocelyn Diabetes Center in Boston gives people medals who have lived with type 1 diabetes 50, 75, and now 80 years. And I believe they used to give people medals for 25 years, but so many people are living past 25 years that they've downgraded it to a paper certificate. And I find it extraordinary. I find it extraordinary that a company would be so, I don't know, wholehearted, thoughtful. I would love to know who came up with this idea to give people with a chronic illness, condition, whatever you prefer to call it, recognition for 50 years of hard work. Incredible.
It is incredible. It is so incredible. I even noticed, I love how we can stalk each other and read after each other. And I even noticed that the former president or CEO, I'm not sure what was his title, of Jocelyn, commented on your award. I mean, that's caring people. There's more care than we like to say. Sometimes we talk about all the bad stuff that's happening in the world, and I don't deny that at all. But oh my goodness, that's incredible, because once you have achieved that place, there's so much you could focus on with the younger ones that have just been diagnosed, and it needs to be. There's so much that can be focused on about how technology and how these specialists have honed in on their skill to do better and create more, and the pumps get better, and it's so many things to concentrate on, that who knew somebody would be human enough to pay attention to 50 years success on the patient's, I wanted to say on the patient's dime, but on the patient's life. That is incredible. And that's what I think that people sitting want to or can feel such encouragement from, because it's wonderful that somebody's going to upgrade my pump. That's wonderful. The next generation is going to have better, but oh my goodness, you held that little, I don't know what you held up, but it looked like a little medal. And somebody honored that in a life that has been day by day. Okay, I've gone on enough about it, but can you tell I'm grateful to them for that.
Sure. Well, actually, yes, what I held up in my blog post was exactly the Jocelyn Medal. And on the back, it says, for 50 years of courageous, something like for 50 years of courageous living with diabetes. I mean, that's a lovely sentiment.
It is lovely.
Right. But, I don't want to leave your listeners with the impression that, you just snap your fingers and you've got 50 flourishing years, right? It's a journey. And for myself, like you, the first 10 years, we didn't have a glucose meter. So you were flying blind. And then, of course, today we have what I call historical gratitude for all advancements that have been made. And I like to tell people my philosophy in being resilient, because this is an every day you have to deal with this, is learn everything you can. I know for me, it always helps me. The more I know, the more it tends to calm me. And, create healthier habits as best you can, one small step at a time. Go for the ones that seem easier at first, so you don't set yourself up for failure. And gather support, whether it's your loved ones, and sometimes it is, and sometimes it isn't, or hook into a network, find classes at your local hospital, or so many communities online where people are talking with each other. So yeah. And then, I mean, I think I can certainly credit some of my success to having other friends with diabetes, so that you can share something that is hard to share from your deepest place, right? With people who don't have the condition.
Absolutely. And when we talk about making sure we announce or make sure we share that we don't want to even advocate that flourishing with it, you just fix it and you're done. I mean, 48 years in, I go to eye doctors. I do whatever I need to do. If it's an ingrown toenail, you don't just go to a nail tech, you go to a podiatrist. I mean, there's every day. It didn't stop because you received an award. It just is how you flourish with that, is how you perceive it, what you do to self-care, and how you move forward with it. Now, help me understand, because of my interest being mental health, how does anxiety show up within your world that you work with, your own personal world? Tell me about anxiety with diabetes. How do you perceive that, and what do you do with that?
I suppose that would show up for me when I think about the uncertain future, right?
Mhm.
Like right now, I have all my wits about me. I'm still relatively healthy and fit, and I can do what I need to do to take care of myself. But who knows what that situation will be in 10 or 20 years. So I can get anxious about that. And how I typically deal with that is I might talk to a friend who has diabetes and is about my age and likely feels similarly. Or I might do something completely different, because the truth is, I can't solve anything right now. And wrapping your head around fear about uncertainty is a really useless task. So I might just go take a walk, or watch something on Netflix, or, hook up with a friend and have lunch, think about the good things. And I think I have a very spiritualist point of view, not religious, but spiritualist. I'm here. I don't know what's going to come. I want to live in the moment as best I can and be present.
Mhm.
And, if I'm doing that, then I'm taking care of the future as best I can.
Yes, yes. I have one lady I know that I'm going to call, and I'm going to say, listen to this podcast, that is our age, hasn't had diabetes as long as we have, but that kind of anxiety you speak so well to, because being afraid is different than carrying fear. Something can jump out of the bushes and you can feel afraid. When the future seems uncertain, I personally find myself trying to plan. If I can plan for then so that everything will be cared for, then my anxiety decreases. But when I can't plan, it's kind of like you can't stop somebody from scaring you if they jump out of the bushes, but you can not walk in fear. You can choose not to. When I can't plan, I can reverse that anxiety by, yeah, I love a good walk, but I can also make sure that I'm whole for this moment. I can't, nobody says I have to be who I was 5 minutes ago, and we can't change in an hour, but boy, can't we do something with this moment.
Yes,
I love it. I
exactly.
love that we can do that. And so the other thing, when you have a low blood sugar, I don't know, this is kind of funny for me, but I can have a low blood sugar, and I learned along the way, it makes me grumpy. It could very easily make me grumpy. But when it's over, I love teaching this to kids, because when it's over, it's my responsibility, privilege, and obligation. My blood sugar's normal now. Now I got to pull me back in and let everybody off the hook. I might not could help it at the moment, but now it's over. Pull yourself back up by the bootstraps and get yourself going. What do you do after a low? Do you know what grumpy feels like after a low? Is that even a thing for you?
I don't get grumpy.
Good.
When I'm low, I feel my heart beat faster. I may get sweaty. I have trouble putting thoughts together.
I do too.
Right. And I'm not aware of my mood changing particularly. In the old days, I used to stand in front of the refrigerator and eat everything
Until
to
you
bring my
got
blood
different.
sugar up. So of course I would be taking a blood sugar of 45 up to 345.
We've all done it. We've all done
Right?
it.
Because when you're low, you're ravenous. You cannot stop that hunger. And so what a perfect time to eat everything you've been denying yourself. But, I'm very disciplined. And so when I sort of observed that behavior and got in touch with the fact that really wasn't serving me, now I'm very good. I could pop 1 or 2 glucose tablets and wait to come up. And then I just move on with it. I'm lucky in a way. I know some people say when they've had a low, it just takes the wind out of them all. I don't generally have that, which is good. And the other thing people might be interested to know is there are more people who get hypoglycemic unawareness when you lose the symptoms of low blood sugar after the age of 60. And I think one of the reasons for that is if, let's say, you just go a week and you have 3 lows, you tend to lose the symptoms because you've overused the system that gives you the symptoms,
Right.
and they won't come back for a couple of weeks. So try your best not to have a low. And I guess when you're over 60, most people have lived with type 1 diabetes for so many years that it has just worn down the system a little bit. And maybe you're more prone to having more times you're hypoglycemic unaware.
Yeah, when I see a type 2 in some kind of a social event or something with a 70, or what looks normal to me, what looks perfect to me, and they're experiencing a low, they don't know what's going on. And I know it's a low because they've been used to it being high. I know then they've been used to it being high. I don't say a word, but I know it's been high, and they don't recognize the low. And so whether it is neuropathy, whatever it is inside, when we get to that place where it's worn down a bit, it's another thing we do is manage and watch that and take care of ourselves. But I love that you've gone to the fridge and just eaten whatever. When I've done that in years past, when I've done that, it was so that I got the number back up. I want that feeling to go away. I want that shakiness to go away.
Yeah, of course.
Only to have it go so high that you're just this way. So, it doesn't take a lot of that to figure it out. It really, without the professional help, sooner or later you find out, I don't want that. This is not helping me. And that's a lot of times why we're in it so many hours. We've mistreated the low. And so it took us to a high, and our body's just exhausted with it. And I know I've experienced that kind of tiredness all day. It takes a while to get yourself back going. And I love it when I can, I don't love it when I have a low, but I love it when I know I can take 2 of the tabs. I don't need 3, and I'm back at it. One quick story. I was with a patient, and my Dexcom was brand new and on my side. My husband was the shared friend who was hearing the alarms. Now, this was meant to help me. You understand, this was meant to help me. And I was with a patient, and he was teaching a college class, and he messaged me, eat. I ignored him. And in a minute, he messaged me again, eat. And the third time he called me. I excused myself. Now I'm trying to pay attention to this patient. I'm trying to pay attention to my blood sugar, making sure that glucose I'm doing it all. But now I've got my husband who's trying to help me. And so he called, I excused myself. I took his call and I said, I know, I'm well aware. I have a glucose tab in my mouth. I'm good. He had stopped his class because he was alarmed.
Yeah.
And he had this new gadget to help me. I went
Yes.
back, I smiled, my blood sugar did fine, and I made it through that session as I had how many times before, but he just wasn't with me. Now, he's been dealing with this, remember, since I was 16 years old. And this has probably been maybe 10, 20, I don't know, whenever it was, but it's been a while. But I said, when I got home over dinner, we're not going to fight, but you're not going to share screen with me anymore. You cannot share it with me. So
really, and if you kept that he doesn't see your numbers?
He doesn't share it when he's away because he is such a caregiver. He's learned how to not to be an enabler, but he would get up in the middle of the night if he thought I wanted ice cream, much less if I needed it. And so consequently, oh no, to this day, he's not a good one to share this. And this is my story and I'm sticking to it. It's for him because, because he just can't know it and me not be where he can take care of me. So we make it light right now, but no, he's not going to share my numbers.
Well, that just shows you different strokes for different folks.
It's absolutely. Now, my son and he, when they're in the house, I will have them by my bedside before I know it if they hear an alarm go off. And so yeah, it's worked better for us. But isn't that funny that he is doing his job, I'm doing mine, and I'm doing pretty well. But for him, he cannot leave that alone. He would have left there had I not taken his call. He would have left there. So we figured out ways to work it without him being the one that receives every alert.
Yeah, no, and you make a good point, which is in relationships, finding a way to make it work. Like my husband is Dutch and grew up in Holland, and before COVID, he was commuting to Holland every few weeks to work because that's where his clients were. And so we created an understanding between us that every morning when I woke up, I would just send him an email that said, I'm up. So he knew I wasn't lying on the floor somewhere with low blood sugar, right? And so that was what we did. And it worked for us. Of course, now he's been home for the last 2.5 years. And I think maybe we need a new rule.
Well,
I
my
don't
husband,
email him.
to this day, I will feel his touch in the middle of the night to see if I'm clammy. And I don't think he is even aware sometimes. It's just an instinct in him. He's making sure I'm okay. It's just, but that was that was the hardest bump we had, is him interrupting my sessions.
Well, my God, you describe it as a hard bump, but it's certainly a loving hard bump. And it reminds me of an incident I had, and since, of course, mental health is your thing, I was in London. I was about 40, and I was dating actually an Australian man who lived in London. And I had flown over. We were going to spend the week together. And I woke up in the middle of the night in his flat with low blood sugar. And I was trying to quietly get out of the bed to go to the kitchen and get some sugar. And it woke him up and he kind of said, what's happening? And I said, my blood sugar's really low. I have to go find sugar. And he grumbled something and rolled back over to sleep. So I walk into the kitchen and it's dark, and I don't turn on the light because the kitchen was open to the bedroom. and I don't want to wake him up, right? So I'm taking all these precautions to be the kind one when I'm the one who needs help.
Needs help.
And I kind of touch all the I don't know, it was my first night there. I don't know where there's sugar. I touch all the countertops. I'm looking for something. And finally I come across a tin of shortbread cookies. And I end up sitting on the floor eating 2-3 cookies until I felt well enough to go back to sleep. And when I woke up in the morning, I decided, no, this is not on. I broke up and I thought to myself, I will not have someone in my life who doesn't care enough that if I'm having a low blood sugar that needs to be treated, he's not going to do anything about it.
Good for
So
you.
like you, I sort of married the opposite, a guy who's enormously supportive.
Good for you. Now, I had no idea at 16 who I should marry. My Lord, I didn't know. I was a little girl. And I also get to Germany and had to go to school to finish high school. My daddy made Tom promise that I would take piano lessons. I mean, just life for a little girl. And now I have this diabetes situation that I didn't know if he would want to be burdened with. I had no way of knowing that I had chosen a man that ultimately, underneath all of his stuff and who he was and what he'd been through, had this servant's heart. So had it been me or had it been you as a neighbor down the street, his goal is to help. That's just who he is. So that's something that I try to show my gratitude, and I've not always been great at letting him know that, but that is something that's huge in our world that I think it's good that we end there today in letting the patients know that we have found people like them that have not been supportive. And why in the heck did we stay? And we have found people that have really found us. It's just kind of that overstretching gratitude of, I didn't even deserve that, or I did deserve it and didn't know it, or I didn't even know to look for it. Whatever the cause, I found someone in my life. Now, the boy I raised, he grew up with it. He just kind of knew it. So he'll say, "What's your blood sugar, Mom?" And I will, like, if one more person asks me today what my blood sugar is. So I'm so grateful for my Dexcom. So I just hold it up. When they want to know, I just hold it up. It is such a delight to meet you. I wish we could do this for 2 hours. And my hope is that for everybody that hears it, they'll follow you. And of the 3 books, if you had to say which one would be relative for what we've talked about today in helping that patient navigate, which one has been the best for that?
Well, actually, they're all very different. The first one I wrote is called The ABCs of Loving Yourself with Diabetes. And it's inspirational essays. In fact, a friend of mine who lives in Costa Rica and has type 1 runs diabetes camp there with the book. So the kids have an opportunity to read the essays and share their feelings and their fears.
Good.
So if you're looking for a way to build a little emotional resilience, and it's got whimsical drawings, that's lovely. And then my second book is about 50 diabetes myths, which is a fun way to get yourself more educated and knowledgeable. And my third book, Diabetes Do's and How-To's, is action steps around food, activity, medicine, and attitude. So I like to say they sort of all hold together and form three legs of a stool. So you'll get something out of each of them.
So I think we should all get all 3, and we don't have to read them overnight, right? We don't have to read them overnight. We can
take your time.
Get to it. Thank you so much for taking some of your busy time to spend it with me. and I'm going to follow you. I noticed that article is from Beyond Type 1. So you have been around, girl. You have.
I've been around for a while.
And you've been doing some things in some very good places, and I don't want to minimize that. I honor you and thank you for spending this moment with me.
Thank you. It's a pleasure. Thank you.
So nice to meet you. Bye-bye now.
Bye-bye.